Perfect.
Oh, amazing. Okay, welcome to this interview on the Embracing Women interview series. I have the lovely Dr. Ulrich Bartels with me today. How are you? And I'd love you to share a little bit about what's brought you to this conversation today.
Yeah, thank you so much, Ashling, for the invite. Yeah, as I say, I'm an obstetrician gynecologist here in the west of Ireland. And yeah, my heart really beats for the women under my care and those in this area to have the most empowering birthing experience possible. Because giving birth can be such an amazing, profound experience for any woman and to connect her with her inner self, with her whole being, with nature. And it's such a privilege as an obstetrician to be part of this amazing gift. And I think we as obstetricians and midwives and birth keepers and have all a duty and a privilege to sort of do whatever we can to to allow women to live their full strength, to live their full birthing experience as it's meant to be. And so in the last, I always was sort of obviously went into this profession with the view to sort of make this as empowering as possible. But the frustration was that the medical school training and the specialist training is mainly focused on risk reduction and safety from a point of view to provide an environment where complications can be dealt with and can be managed. Whereas the truth is really that if emotional safety is provided for the women, then the rest will actually more or less sort itself out, and the complications will be actually much less. So this revelation then empowers us to sort of look at it in a different eye.
Yeah, wow. It's interesting you mentioned emotional safety because today I was speaking with someone about my program that I support women with preparing for pregnancy and birth. And I had this realization that really my work is providing emotional safety, providing guidance in how to process your emotions, be connected to yourself and what you're feeling and what you're needing. Which, when we look at humanity as a whole, like previous generations, they didn't have the emotional intelligence that we have now. They didn't realize how important their emotional health was. So I suppose that makes sense then that the way that the medical model was meeting birth didn't have that holding of the emotional experience. So I'm curious to know what, did you mention that you went in to this line of work with the intention of supporting women, but when did you realize that the emotional support was lacking and it was needed? And was there a particular experience or patient or something that like really awoke you to that, or what, did you always feel that?
But I was very privileged over my 33 years of career now to witness some very amazing birthing events where women were fully secure in themselves and they had that emotional safety. And running both the HSE practice and the pilot practice, the beauty with the pilot practice is that I can be direct part of this emotional safety. And I often have that the patient, who's in the pilot practice often is very much used to make decisions and all this in a professional life and, feels suddenly very unsafe in the hospital environment. The staff then sort of have often an edge with the patient then. And then when I come in, because they know me, that emotional safety is restored and the patient suddenly feels safe. And that's just very beautiful to see. And that brings home the aspect how important that is, this emotional safety. And obviously there's a science behind that because oxytocin, the love hormone, is obviously the vital hormone to allow a labor to move on. And and only when emotional safety is there, oxytocin will flow freely, And I always instruct my couples to say, listen, if you're feeling this unsafe, or you're suddenly unsettled with something, or something rubs you up the wrong way, or whatever, right? The best thing to do as you as a couple is to just give yourselves this big hug, right? Just embrace yourself, give yourself a big hug, breathe slowly, say supporting words to each other, and enjoy this. And I always say, if you give yourself a hug for 20 seconds, you're actually giving yourself more oxytocin than I can give you in a drip. Um, and that's the pure truth. That's the pure truth. The tragedy in the hospital setting is that obviously the staff members are humans too. And obviously the staff members are also yearning for safety. And they may feel unsafe. They may feel unsafe because they have been scrutinized again and again. And I must say, the scrutinization has increased dramatically in the HSE and in the NHS. And we've seen these reports recently coming out, the Auckland report and the Lady Whatever report, which are all looking at failings and blah, blah, blah in the system. And the truth is, what happens here is that for staff, the emotional safety often comes by clinging on to the guidelines. There's a clinging on to the guidelines. And the more the guidelines are adhered to, the safer the staff feels. And if a patient comes in now and say, I don't want procedure XYZ, the staff member suddenly feels unsafe because the patient is not conforming, right? And they're afraid that something will go wrong. And they're afraid that they'll be scrutinized. So their emotional safety is waning. And that may then lead to a fear, flight, and whatever reaction which may come across to the woman they're looking after as either rudeness or coldness, but whatever it may be. But it will, of course, destroy then or take away the emotional safety of the woman. So very quickly, we see a cascading of loss of emotional safety, both for staff and the woman who's centerpiece. And both are upset, both are grieving, and both might see the other suddenly as an enemy and getting from bad to worse.
Yeah, it's so fascinating that our conversation is jumped straight into the emotional safety. I'm so delighted because it's so fitting for where I've been at today with my own work. So my mind now is wondering, like, or I'm wondering, the thought came into my mind: is it about bringing emotional safety, emotional regulation, education into these workplaces, or what? How can we? How is that going to change? So my next question was, like, we're seeing this conversation like that we're having, and in the collective about integrating holistic nervous system health and root cause approaches alongside conventional medicine. How do you see that shift from where you sit? Like, do you see medicine as a whole shifting, or I know your focus is mainly with women and birth, but I'd love to hear you speak into that.
I think it's both important for staff and for clients alike, that they're aware of their emotional safety, that they're aware of what is draining them away. And I must confess that obviously I'm only human too, and I've had experiences where I felt my own emotional safety was sort of not a given anymore, and fortunately it had prompted me to sort of be curious why there was a lack of emotional safety, be curious about my own sort of history. And as you correctly mentioned, Ashley, there a minute ago, there's people now going back into past lives, but we don't necessarily have to go that far. Well, we might have to go that far as to our own birth, and we might have to go as far as before our birth, right? We may have to go as far as our siblings and as our parents. And we may have to go as far as that and see where the emotional safety has been eroded, where we had a lack of attachment, where we had a lack of stability. And that stability may make us then more vulnerable to sort of threatening of our emotional safety later on in life. And only by doing that work with ourselves can we then be settled enough to provide that emotional safety, because the patient will immediately feel that. And I must say, over the last couple of years, I'm very grateful that I had been afforded the opportunity to do that work on myself. And I must say, my clinics are now running so much more beautiful, for want of a better word, um, because I can just ooze out this emotional safety and make the patient feel yeah, feels of embraced, for want of a better word, in an emotional sense, right? So that she can settle down. I see them coming in at the clinics this afternoon, and this poor lady came in and she was basically shaking like a leaf, because she was so scared, right? And I'd asked patients before, and and I asked them, "What are you most afraid of?" And they said, "You." Right? So they're often most afraid of the doctor, right? So there she comes in, is terrified what might happen to her today, and then this male white doctor sits there and terrifies her out of her mind. And my main duty really is to give her that emotional safety, right? That she can then reconnect with her own self, with her true self, that she can reconnect with her prefrontal cortex and so on, and really make sort of decisions and fend for herself. So that's really important, as I say, in the gynecological clinic, but of course much more in the whole labor situation.
Mm. And we hear, I think it's quite, what's the word? In the general population, the words attachment and attunement, and like we hear, oh, mothers, listen to your intuition. But really, how can a woman listen to their intuition if they're not attuned to their own emotional well being, their own emotional state? And that is kind of the work that I do. I'm supporting women to develop that. But we see all the time, I guess, women and men alike are having experiences with the medical system where they are dismissed and the doctors are not emotionally supporting them. So, yeah, I wonder, like, can there be reformation in the education of these people in this profession? I always feel so disheartened when I go to the doctor and I'm not receiving the care that I really feel should be given. And a lot of people will come back to me and say, well, that's not their job to provide emotional support. But I think health, if you're working in health, that's just a massive part of health.
That's the thing, and as I say, it starts really sort of with the healthcare professionals' own work, that they have to do that their own work, but it also starts with sort of the person being able to advocate for themselves. I was looking after a man another time, and this man was feeling very unsafe during the birth, whilst his partner was birthing. And certain things were done to his partner which he didn't quite consent with, but he was feeling paralyzed to speak up for her. And he was then very traumatized. And the truth there is then, you see, for everyone to realize we never react to the present. We always react to the past. So that's the first truth we all have to remember. And once you have realized that truth, the question is then, okay, let's acknowledge that. Let's just sit with this feeling. And let's go back. When did I have that feeling before? Often you can help yourself by doing that by saying, okay, where do I actually feel this in my body, right? And that may be very strong then the feeling might come back. And then you can allow yourself to go back. When did I feel that before? And so for this man, it came out that there was a very serious situation at home. The father was very violent, was on alcohol, and was hurting the mother. And he couldn't speak up for her. He couldn't speak up for her. He couldn't defend his mother. And he was re-triggered in this birthing scenario, where the doctor wasn't violent or drunk or anything, right? But at the same time, he was reminded of his father, because this was yet again an authority figure, right? And I think we have to have this curiosity and that openness for these questions and say, okay, let's find out what's happening here, right? Why is this bringing up such strong emotion, right? And the strong emotions always tell a very, very important story. you know. So, and it's very important as well to reconnect with this man and say, you're not broken, you're not weak. Your brain just learned to survive in a situation where your father was overpowering and you couldn't possibly defend your mother because otherwise you probably would have been hit yourself, right? You probably wouldn't have survived. So you learned not to fend for her because you just couldn't. So you're not broken, you're not a weak man. There's nothing wrong with you. You just couldn't do it because that's what you learned. That's the program you learned. And that's what I really want to sort of do in my birthing center, which we're going to create in this birth center group. That
Yeah,
we
I was
allow,
about to ask you to share. I know you have a vision, and we'd love to hear
yes.
your vision.
Yeah, so we are with the Irish birth movement, and we formed this group on the Irish Birth Center and the Birth Center of Compassion, we're calling it. And in that scenario, what is really what should be a key work pattern is that even before couples decide to conceive, that we allow them to be curious. We allow them to look at their stories. We allow them to look at their patterns. And then we give them the support to work at these patterns and heal them, to heal them with self-compassion. Right? And only when these patterns, these programs, whatever you want to call it, have been healed, have been embraced in compassion, then one can actually react to the present. But until these deep traumas are sitting there, they will be triggered. And that's only natural defense reaction. There's nothing wrong with a person like that. It's just your body doing what it has to do in a time of threat.
So, tell us more about how that would look, how this new paradigm of birth and health looks.
To provide all the support to provide that emotional safety. And I say that starts off with this work on previous experiences, which are bringing up strong emotions at certain triggers. The truth is, of course, that for many women or many couples, they've never been in a very threatening situation since their childhood, probably. So they think they're doing grand. They think they're doing fine, right? And then they're suddenly 12 weeks and they realize, oops, I can't sleep. I'm nervous all the time. I'm suddenly frightened, right? Because now their fear reactions are stronger. Now they're responsible not just for their own safety, but they're also responsible for the safety of the other one. So whatever fear mechanism, whatever mechanisms that were there for protection, now stronger. Now they're becoming 28 weeks, and it becomes even stronger. And now they're suddenly 36 weeks, and all becomes very clear that this is going to happen. Right? So the important work will be to do this before this comes to that stage, that we can do this, address any previous patterns early, be curious about them, support people through it. And all sorts of techniques can be used for that. Right? There can be EMDR, there can be brainworks recursive therapy, that can be sort of art therapy, that can be gardening therapy, there can be companionship with animals, there can be sea swims. Any of the spectrum hopefully can be offered, and we'll be inviting practitioners of many disciplines who are helping in sort of supporting people to sort of find their strengths again and to sort of letting go of ingrained patterns. You know? And that is also the other need for this birthing center, because you see, location can be sort of a giver of emotional safety. And for one woman, emotional safety may be actually the hospital setting because she feels emotionally safe because she knows there's an emergency theater and she knows there's a special care baby unit for a baby if there's a problem. And for another woman, that may be a home birth. And for a third woman, that may be a birthing center. But the birthing center will have the beauty that it will combine both. They will give you a bit of a sense of a home away from home, but it'll also give a sense of a medical backup if there's a situation which needs more support. So that'll be the ideal sort of in between, where hopefully we can provide emotional safety for a wide spectrum of people. And of course, people can choose to do whatever part of the journey in the birthing center and then move on to either whatever setting they prefer or they need. But at least they've had the opportunity then to support them with their emotional safety as much as possible.
Mm. Oh, beautiful. It's a dream which will come true. Um, and we know we've kind of got ourselves into a bit of a pickle here because all the intervention in hospitals makes so much sense because it is not a very soothing environment. It's not an environment that's going to promote that oxytocin. And I suppose that's where like the education piece comes in. We need to educate women and couples about what's needed to birth their babies. And it's so exciting speaking to women, realizing, how, like, getting them in my program, like getting them to think about how do I want to raise my children? How do I want to mother? Because that gets them to really look at themselves. It just naturally will make you look inward and at your own upbringing. Um, and that's really empowering. And I suppose I'm sure you probably share the same passion for me as me for the next generation, and they deserve to be born in safety and love, and the difference that will make to the next generation.
Yes. First, one little note about education. The interesting thing about education is if it is information that can only be processed by the prefrontal cortex. The trouble is if you feel emotionally unsafe, your prefrontal cortex is off. And that's often where the healthcare provider and women who are feeling afraid are clashing, because the healthcare provider might sort of exude an avalanche of information with sort of statistics, with figures and numbers and stuff like that. But a person who is actually already feeling unsafe feels even more unsafe if flooded with information, because the prefrontal cortex is off. And whatever flood of information comes just floods literally the brain and actually doesn't sink in anywhere. It's just like rain on a soil after a drought, right? The water doesn't get into the soil, right? That's the same as information here. So that's the interesting thing, that before you give any information, you really have to sort of provide the emotional safety first. And I must confess, and I'm the first to confess it, that often went wrong in my and clinics as well, right? That I was giving information to women and not cupping on that this poor woman is just so frightened. That is just flooding her, right? That's not going anywhere, this information. That's just making her more unsafe, right? So that's one thing. And what was your second point?
I don't remember. um,
It's not just my Alzheimer kicking
yeah,
in.
don't worry, don't worry. Yeah, I had two threads come up there. We're
Mm.
coming towards the end of our interview now, and um, I wanted to ask you, what you've already sort of shared, but just to maybe I don't know, wrap it up. Um, what does embracing women mean to you, and what does embracing birth means to you?
Really providing the safe container, right, where they can feel that they are acknowledged as a person, as a woman, that their power is acknowledged, and this is their space to do whatever they need to do with it. And that's how I would now uh, that would be the message I would now try to bring across to people coming to me seeking for support. And say, this is your space. You make of it what you want, and you better ask me as many questions as you need to to feel safe and to make your choice, whatever the choice is. We had a beautiful discussion this morning for a woman, who was deciding whether she wants to get started with her labor or not. And I said, this is really up for you to decide. This is the information I can provide. These may be pros and cons for you to ponder over it, but it's for you to decide this, right? And you know your body, you know your baby. You are in communication with your baby the whole time. You know, um, and as I say, if
But
there was, yeah,
you are the exception, I have to say. Like, what do you have to say about other OBs that are not providing what you're providing?
they're terrified themselves. They're terrified. We do a handover discussion every morning, without talking with inside. I see it as these discussions, when people speak up, and some of the staff members, they speak out of very few speak actually out of a secure place. Many of them, you can feel, yes, this poor person feels unsafe too. And as a colleague, all I can try to do then is as well to ooze as much safety to them too. Um, Give sort of a safe pole that we are sort of adhering to the guideline. Yes, it's all documented chart. Yes, you don't need to be afraid. It will be on the notes, to put them at ease, But that is the trouble, that we are all only humans. And of course, we are in a terrible world right now, where Holocaust is happening under our nose, and we feel all powerless. Democracy, which used to be the column of our society, is crumbling completely. The environment is crumbling completely. The food environment has crumbled completely. So everything is going down the hill, really. So no surprise that people feel terrified. And then of course we have microplastics in the system. We have environmental toxins like forever chemical system. So these are all brain and the hormonal disruptors, and they're all changing our brain structure. So no surprise we're all frightened. Right? But all we can do in this environment is to sort of to give as much safety to each other as we can, and just remind be reminded of our humanness, and that we are in this boat together.
Oh, that is so beautiful. And, I really hope that maybe some of your colleagues will listen, or this will reach people that are working in this field. And I hope that they can be touched by this conversation and open their mind and spark their curiosity, because I'm sure everybody goes into these fields and these professions with the intention to help, but then the way that it's being taught, the way that there's all these protocols that they have to follow, I just feel so heartbroken to. I'm smiling because you ended on such a beautiful note, but I just want. I also would love to know your opinion on all of the interventions, and I know that maybe it's from the fear and the setting and the people not preparing, but yeah, what do you have to say about that? Like, I would love to know in your day-to-day experience, like, actually with women giving birth, are you having to do these interventions, or you know the way, like, how do you stick with these protocols? Is there strict protocols that are saying that you must have, like, once the waters break and once this happens and all these rules? I really would love to
Of
hear
course.
from the inside what that's like.
Yeah, of course. Say, for example, we have one situation where if a woman chooses to embark on a pregnancy at age 40 or more, right, we have to be seen to offer an induction at 39 weeks, right? So it really comes then, depends on how you bring that across, right? So you could say, okay, I'm going to do a sweep for you today, and we're booking you for induction for tomorrow. And that's it, right? On the one side of the extreme. Or you could say, listen, this is what the guidelines say. You're embarking on a pregnancy a bit later in your life. We know that there may be some sort of additional chance that the placenta mightn't work that well as time goes on. And because of that, I'm going to offer you an induction from 39 weeks on. But it's for you to sort of decide, does that feel right for you? Do you think that, what sort of limit of risk do you accept? And where does it sit with you? And then we have a chat and see where she comes from. And then I sort of make sure that the point is really that this is an offer, right? And I explain why that offer is being made. And as I say, that's because of the placenta might not work as strong as it may have in a woman who's a bit younger, who chooses to go on a pregnancy a bit earlier in her life. But that's just how that is. She can't change her age, but she can choose what she's going to do with this information, that there may be a slightly increased risk for a complication for the baby. So that's really where that comes from. So these guidelines get changed, not all the time, but they get changed again and again. And this limit, for example, has moved now from 40 weeks to 39 weeks, right? And we used to, for example, let anyone go over up to 12 days, and now we only let them go over a week. Now we offer an induction already after a week. So you have to inform people of these offers that they are there, right? But in fairness to the guidance, they actually do also use that word offer, right? But many colleagues then sort of say we have to induce you at, right? Or you're not allowed to go over, right? And that's of course a language which has no place in this. Right? We are
And
not allowing anything.
what are your what's your opinion of interfering with birth, and what's your opinion of epidural?
You see, the epidural is always a sign where the pain has been interpreted by the woman as a danger. And that's why an epidural is needed. When I say to the woman, why do you think you have pain? You have pain because your body wants you to do something. And that's, for example, if you step on a sharp nail, you have a pain to remove your foot, right? If you have labor pain for two reasons. A, to bring yourself to a space where you're safe, right? And B, to move your hips accordingly that the baby gets through the narrow pelvic canal, right? These are the two reasons why you have pain. But you may also have pain because you're frightened and your pelvic floor muscles may be tight. And then very rarely you may have pain because the baby is actually too big. The interesting thing is, though, that over my career, I've always heard the women say that. They say it, they know it themselves. They actually say these words, my baby's too big. And I'm always um, pleased to sort of actually see that the women's wisdom is there, that they actually know that themselves. But it's very rare that the baby's actually really too big. That's very rare. Right? So in the vast majority of cases, it's either of these three reasons. The woman doesn't feel safe, that she's too frightened and her pelvic floor muscles are too tight, right? Um, or as I say, that very rare reasons that the baby is actually really too big, but that's very rare. So in order to overcome the first one, make sure the woman feels safe. So give her whatever we can that includes the work before pregnancy, in pregnancy, and then at the setting where she just is. And then secondly, for the movement, make sure free movement is provided. So I encourage my woman, for example, my ladies looking after, I look after, that they, for example, look at walking with a bit more hip swing to get into a habit of moving the hips a bit more freely, right? That they may be doing some Zumba classes or that there's some Latin American dancing and stuff like that, that they get a bit of a swing in the hips. And that they remember them when the surge comes, when the baby is putting pressure on certain part of the pelvis or the muscles, that they allow their pelvis to move to massage baby into that very spot. And to remind them this baby's head is basically like, and sorry for the comparison, but it's a bit like a piece of dough, right? Because it's malleable, right? So the head bones are not connected yet on the top. There's a gap, and the gap can be closed and it can be overridden, the bones, a bit like that. And then the bones are soft, they can bend. So a head which is absolutely too big, if it was made of concrete, will actually be molded into shape to fit through that particular woman's pelvis if it is afforded the opportunity. And the opportunity is by really a lot of movement in the hips to allow that to happen. And that's where the epidural, of course, is a catastrophe because the woman is then lying on her back, is no longer moving her hips. So all this molding is not taking place. And therefore, the poor womb has to work on overshift to press the baby out rather than having the baby massaged out. And I see that every time I come on shift on labor ward, right? All these poor women are lying in the bed in tremendous pain. And the first thing I do, I get them out of the bed, get the husband, get the woman to hang on the husband's neck and say to his husband, put your hands on her hips, move her hips, and tell her to move the hips. And the pain is at least only a third, if not a quarter of what it was before, if not even less. So the pain is immediately lessened dramatically.
I have another question. Do you think that the way, we kind of live in a time where people are very afraid of discomfort and we have so much to avoid discomfort? Like so many. I'm just curious if you think that is part of why women. I guess there's so many elements to it, not being
Mm.
guided or having elders or
Mm.
kind of being educated about what to expect, etc., and not having adequate support. But do you think that's part of why, I hear women say things like so many women say that they couldn't stand the pain and that they had to get the
Mm.
epidural and blah blah blah. And then there's a few women that I hear and who've had like natural births, home births, and of course it was intense, but they didn't really have the same like language of, you know what I mean?
Yes.
I'm curious if you think that that's part of why we've gone so far away from like natural, organic, like birthing.
You're very right. There's two important points in your point that you're making. A, yes, you're absolutely right that pain is perceived or people are educated that pain is something bad, right? There's something to be scared of and it has to be medicated away. So that's in many people's mind, and they often have many people get taught that medicine is basically like a car garage. You bring your car in, you get your glow plugs changed, and everything's fine, and they see their bodies as the same as they would look at their car, not realizing that these are actually signals. Pains are signals from your body for you to do something and to act on something, right? So that's one thing. Another thing is, of course, that all pain is created in the brain. All pain is created in the brain. That's very, very important. So what happens is something happens in the periphery. The periphery signals this up to the brain, but it goes through loads of different centers in the brain, starting off as the amygdala, the safety and emotional center, right? And then it gets interpreted by all these different centers, the hypothalamus and all this. And then the end, a message gets up to a central command, danger or not danger, pain or not pain, right? So there can be pain, danger, and pain, uncomfortable but manageable or useful. Um, and that's the difference. Then at the end of the day, is the pain perceived as a danger pain or is the pain perceived as something to work with, something to actually
Yeah, there's a
embrace?
purpose to this.
Exactly, exactly, as a purpose and as a message. That's what, and that of course comes back to what I was saying earlier. What programs are running in the background for this person, right?
Yeah, and I know, let's wrap up now, but what came to mind just there was it reminded me of, why the practice of meditation is so helpful for
Mm,
women to prepare because meditation is about fully being present with whatever is unfolding. Um, and if you're practicing that day to day and you're practicing noticing what you're feeling and being able to be with challenging emotions, you're building that muscle of presence and acceptance that
exactly,
a
yes.
lot of people don't have.
No, yeah, absolutely right. Yeah, absolutely right. Yeah, there is a very nice practice by Tara Brach, which is called, you've probably heard about that, rain. We sort of just recognize the feeling that starts off with. Just recognize its feelings, just name the feeling, right? And then just sit with it. Just allow it. Allow it to be there. Don't fight it. Just sit with it. And stop telling yourself you shouldn't feel it. And then next investigate. Ask what the feeling believes about you. What do you feel in your body? What's the story about it? And then nurture. Speak to the part of that is suffering the way you would speak to someone you love, right? So that might be a nice little routine for people sort of to do in these sort of situations.
Oh, thank you so much, Ulrich. It was beautiful to hear all your experience and your passion and your vision. And I feel hope. I feel hope for when I'm interviewing people. I'm like, look at all these amazing people bringing all this wisdom, and um, yeah, I really love that practice as well. So hopefully, people listening will take part and look up Tara Brach and also check out. I'll put it in the description, all my offerings and anything, contact information for Ulrich. He's based in Mayo. Yeah, thank you so much.
You're very welcome. It's a great pleasure.